So the four main cofactors that we deal with in the clinic are alcohol use, body mass index, weight, intercurrent diseases such as viral hepatitis. We talked about hepatitis C being the primary problem for the patient, but if they also get acute hepatitis A or acute hepatitis B, that can significantly deteriorate their condition. And the fourth is intercurrent use of other drugs and medications. So let's take
alcohol use and hepatitis C is a really bad combination. We've been unable to find a safe amount of alcohol. Patients often want to talk about what's the right amount, and we've really been unable to find a safe amount. So if you have hepatitis C, it's recommended you don't have any. If you get cured of your hepatitis C and you had hardly any damage in your liver, it might be fine to have moderate alcohol use. But up until we know, or up until you're cured, really the best solution is to have no alcohol.
Important factors that promote fibrosis progression are alcohol, and alcohol is synergistic with the virus. So it's more than additive in terms of the fibrosis progression.
It's very important to take a detailed history about alcohol use and emphasize to the patient that alcohol is a liver toxin. Probably before you treat a hepatitis C patient, you should consider dealing with the alcohol issue before you initiate therapy. Because the worst thing that can happen with today's expensive treatments is to have someone become non-compliant to your treatment, the hep C treatment, because they have ongoing use of alcohol.
We're learning that that the virus itself, namely genotype 3, seems to be an important cofactor, more important than the other viral genotypes. The level of the virus, either high or low, unlike other diseases such as HIV, really doesn't play a role in the progression of the disease. Although not very common in this country, in some areas of the world, people have infection with more than one hepatitis virus. So you can have hepatitis B, hep C co-infection, and that can also promote fibrosis progression.
We have vaccines that are almost 100% effective in preventing hepatitis A and B. So it's extremely important to take a history of whether or not your patient's been vaccinated. And if they haven't, typically we measure hepatitis A and B antibodies to see if they have any immunity. All the hep C patients who lack immunity to hepatitis A and B should be vaccinated.
The other thing we see is more fatty liver disease. So patients who have obesity or diabetes or one of the other risk factors for this, they may have the fatty liver disease in addition to the hepatitis C. And again, two things going on in the liver is a bad combination. So we really encourage patients, whether you're getting treated or not, do what you can to take care of that liver. If you're overweight, what can you do about it? If you have fatty liver disease and diabetes, is your diabetes under good control? Are your lipids under good control? What can you do that way to take the best possible care of your liver?
You need to get control of the weight and the metabolic problems that come with that if you're going to also deal with your hepatitis C patient. So it's very important to look carefully at their weight, look at their diet, exercise, general wellness principles need to be in place. It's extremely important to take a history of concurrent use of medications. But acetaminophen is a common constituent of a wide variety of over-the-counter products. It's almost ubiquitous in cold remedies, for example. Right now, the recommendation is for a patient with chronic hepatitis C that that person not exceed more than 2 grams per day of acetaminophen use.